We have to stabilize primary care right now. Primary care doctors are the air traffic controllers of our healthcare system.
The Attorney General's in with us today, fresh from demanding more money for doctors and outlining why he's going after CVS as a drug industry middleman, or PBM.
Holding the powerful accountable from Washington, D.C. to right here in southern New England. This is 10 News Conference with Gene Valicenti.
Good morning, everybody. I'm Gene Valicenti. This is 10 News Conference. Joining us right off the bat is Attorney General Peter Neronha, a Democrat now in his second and final term. Welcome back, Attorney General.
Thanks, Gene.
Well, you're in the news more than I am. You're on TV more than I am these days.
We're busy.
All right, let's get right to it. Healthcare, big issue. You're fresh from holding a news conference, outlining your vision, how to fix the healthcare crisis. Before we get into all of that, it's well known that your wife is a very accomplished physician. Is this a conflict of interest for you to demand more money for reimbursements, having been married to a physician?
Yeah, I don't look at it that way. I look at it through the lens of Rhode Islanders who are feeling the pinch of not being able to find a primary care doctor. At least 12% of Rhode Islanders can't find one. I think the number is actually higher than that.
Yeah.
So if we don't fix our healthcare system so that it attracts and retains primary care doctors, we're going to continue to see a lack of access to primary care. And that's going to help cause our healthcare system to continue to spiral downward.
I understand, but you're advocating for more money for doctors, higher reimbursements that would directly benefit you as a family member. You're married to a doctor.
Yeah.
Also, she's associated with hospitals. You could see that's a fair question.
Sure.
But you dismiss it outright?
Well, look, I only dismiss it in this way, that my wife and I are sort of in our 60s, so the benefit to her, if there is any, is sort of short term. I just don't look at it that way, Gene. I mean, we know there's a crisis, and we know we have to fix it, and we know how to fix it, and there's really no one else to step. I mean, I can't really recuse myself and have somebody else lead it, so I'm leading it, and I hope Rhode Island residents will know that I'm doing it in good faith.
Well, let me ask you just why not? Why can't you just designate a special person in your office and you handle the health care, because I'm a little too close to it. If I get more money for a doctor, I'm going to benefit.
Yeah,
I
think, Gene, I learned from my experience as U.S. Attorney. And I think you see this with acting U.S. Attorneys, that when whether it's a presidentially appointed U.S. Attorney or an elected Attorney General, we're wired to lead in ways that our replacements cannot. And so it's only been in rare instances where I've recused. So for example, when my wife's practice was acquired by Brown Health, I recused myself from whether or not that had antitrust issues. So certainly in that context, I would and did recuse, but this is a matter that affects a lot of Rhode Islanders. And I've been talking about this for a long time. I feel like we are in a unique position to lead, really because of an absence of leadership elsewhere, and I feel really compelled to do it.
Okay, let's talk. Yesterday you said you demanded more money for doctors, raise the reimbursement rates. That's why we have a shortage. They're making more money in Massachusetts. We've all heard the comparisons and the stories. And yet there's another side to that. Governor McKee says if you do that, you're either going to raise premiums or raise taxes. I'll let the governor speak in just a second, but go ahead. Your initial reaction, are you willing to raise premiums or taxes?
Well, listen, I think, Gina, I'm not sure that that's altogether necessary. For example, we know that if we invest more in primary care or anything in health care with our Medicaid rates, which is what we're proposing, they're 37% of Medicare, let alone commercial. If we raise those rates, we get $2 federal for every one. We can lift the entire system and retain the doctors, and not just doctors, nurse practitioners, and other advanced practitioners. We can ensure that Rhode Islanders can find a doctor. Rhode Islanders can't find doctors. 25,000 patients are in the wind because Anchor Medical closed. And Anchor Medical didn't close because of bad management. They closed because they couldn't meet the bottom line. They didn't go into bankruptcy. They just wound down. There's a reason for that. Every major system in Rhode Island, these are the facts. These are the facts. Every major system in Rhode Island, Brown Healthcare New England, is subsidizing their primary care doctors by about $150,000 per year. What does that tell us? That tells us that what the reimbursements are for Medicare, Medicaid, and commercial aren't enough to keep doctors in the system, and that's why we can't retain them. Or recruit them. That's the problem.
There's immediate push to get $90 million from the legislature into the pot, get the money to the docs, so they'll stay here, and they'll feel better about staying here. Go ahead and play the governor. This is cut 2 for us. This is the governor saying, "Hold on, it's easier said than done."
If we raise the rates on the reimbursement, we are going to raise insurance rates, or taxes. And before I do that, I think that it's important to really understand the landscape. And the landscape is not just on the reimbursement rates, but it's also on the efficiencies of the operations that are being operated.
You said, if I raise the rates, I have to raise taxes. What was the connection you made?
You're either going to raise taxes, because remember, this is a budget issue. So if you change reimbursement rates, it will change the budget. So they're asking us to put $90 million into our budget.
Yeah.
Well, that doesn't come out of the air. That comes out of your pocket.
I understand what you said.
Yeah.
You get the $90 million from the legislature, the state. You'll get $2 for every $90 million you get. I get that, but he's saying you'll have to either raise premiums or taxes.
No, you can do it.
Which one is it?
Yeah, it's neither one. See, here's the problem with what the governor says there. He assumes that health care is optional. Fixing it's optional. It's not.
I don't think that's fair to him. He has his own plan. He's working on it. I know you dismissed it, but he'll tell you just the opposite.
Well, let me explain why I say that. We have two hospitals that may close, Roger Williams and Fatima. We've been there when he hasn't. Let's face it. We are the ones, my office kept them open for 3 years while the governor, frankly, did nothing. Now they're on the cutting edge of a knife, and does he have a plan? If those hospitals close, I doubt it very much. Those are the facts. The other hospitals are facing the same problem. It's not just $90 million for doctors. It's $90 million so that the healthcare system as a whole, with $270 million, can stabilize and have the kind of equipment that hospitals need to serve Rhode Islanders. There is a patient who walked into a hospital with a large brain aneurysm, and the hospital she went to couldn't find that aneurysm. It was found later at Rhode Island Hospital. That hospital couldn't find it because the MRI machine was broken. Okay, that's the state of our healthcare, anecdotally and in the data. And so it's not optional to fix healthcare. And what the governor says is, well, in my $14.2 billion budget, I don't prioritize healthcare enough to put $90 million at the center and cut elsewhere. I'll give you an example. Just the other day, he put $10 million more towards these two hospitals because he's finally recognizing that he must do something to try to save them at this late moment. I don't know if it will. I don't know whether it will or not. But the point is, he found $10 million. When we start budgeting from a place where healthcare is at the center, like education and infrastructure, we start there, not somewhere else. What won't fix it, frankly, Gene, and I'm being fair here to the governor, what won't fix it is a $200,000 loan forgiveness program when the average medical student graduates with $250,000.
Okay.
This is weak tea for a major problem.
I know you came out against him as soon as you came out with that plan, and he said, "Oh, you'll find a way to pick on me for anything I say." Said that about you, about this notion, and then we have to go to a break. He says, if you want the $90 million, you're either going to have to raise taxes or raise premiums. You're dismissing that outright?
Absolutely. It doesn't recognize that healthcare isn't optional. It's not optional. When you're budgeting, healthcare is not optional. The governor still thinks it's optional to fix our healthcare system. It isn't, and he's going to bear the fruit of that. He's going to sow. He's going to reap what he sows when the healthcare system spirals downward if he doesn't fix it.
You're saying get it from somewhere?
Absolutely. Absolutely.
Find it. Okay.
Yeah.
All right. Let's hold it there. We'll be right back. We'll continue the conversation about healthcare, and you're going to be aggressive towards CVS. Said that yesterday, and other pharmacy benefit managers. We'll be right back.
Thank you for turning to 10, your news leader. 10 News Conference with Gene Valicenti continues right now.
And we're continuing with the Attorney General, who's with us, talking a lot about health care, but we're going to get to other topics, too. Just quickly, I'm just putting it in a nutshell. It's very complicated. The Prospect Holdings owns Charter Care. Charter Care controls Roger Williams and Fatima. They're belly up and in trouble. You have a lot to do with this. Just bring us up to date. Where do you stand now?
So where we are now is we managed to get them out of bankruptcy in Texas. We were there on day one, and we were able to convince the bankruptcy court to allow the Centurion deal to go through and not put those assets into bankruptcy.
It's just the one. Centurion is the new buyer.
The new buyer.
From Georgia.
Correct.
They want to go from a profit to non-profit.
Correct, and they got to raise money to do that. They're trying to sell bonds on the open market. One of the reasons why they maybe having some trouble selling those bonds is because we have an unstable healthcare system.
Okay.
The reason why Roger Williams and Fatima can't make it is because our Medicaid rates are too low. So those hospitals, if we can't get them bought, and if they can't succeed in the next 2 years, we're going to lose a lot of beds. We have 80 behavioral health beds at Fatima that can't go to Butler. There's no room. So this is a crisis where fixing it's not optional.
Okay, I just want to go over it one more time, but I've got a lot of other things to talk about. Prospect controls Charter. Charter controls Roger Williams and Fatima. They're belly up. It's an out-of-state company. Centurion wants to buy them.
Correct.
To complete that deal, bonds must be floated and secured, sold.
And they're on the marketplace right now. So they've got to buy, there have to be enough buyers so they can close that deal with the Georgia company. We're going to find out whether that happens in June or not. If it doesn't, Gene, it goes back to the bankruptcy court, and it's possible those hospitals could close. So that's why, as I say, they're on the cutting edge of a knife. If that deal doesn't go through, we can end up back in the bankruptcy court. We'll do everything we can do to protect them. I hold $50 million of private equity money that I'm not giving back to that private equity firm, that I'm holding for those hospitals if they can complete that deal. If they don't complete it, we're going to be fighting to keep that money right here in Rhode Island.
Here's an oddball question. Would you buy the bond? Would you tell me to buy it?
Well, I tell you what, if we do what I suggested yesterday, yes, because if you lift those Medicaid rates, those hospitals can succeed. The reason they can't succeed is because our reimbursement rates are too low. I'm going to give you a very simple example to make the point very clearly. If you go get a physical tomorrow and you're a Medicaid patient, your doctor gets $37. If you're a Medicare patient, they get $100. If you're a Blue Cross patient, they get $200. You see the problem? You have a lot of Medicaid patients like we do in this state. We're getting paid $37, and we don't have enough commercial patients getting $200. The money in the system goes down. It's why we have to grow our economy with the kinds of businesses that will insure their workers. Small businesses many times don't. And to think that Medicaid is only for poor people is wrong. I saw the governor say that yesterday. It's just wrong. There are working men and women who are on Medicaid. We've decided to insure those people in the state of Rhode Island. That's a good decision, but we have to pay for it. And $37 for a physical isn't going to do it.
Okay, let's move on to something healthcare related. You just wrestled $10 million, $11 million actually, out of the Barletta contamination story. This was contaminated dirt brought in for the 610 connector project, came in from Massachusetts. It was a bad thing to do. You wrestled money out of Barletta for that, and you decided to put that toward neglected children when it comes to dentistry. Now, it's a little controversial because you're using a middleman. You're using the Rhode Island Foundation. By the way, it's been argued, I've heard this argued, talk radio and a few other places, nobody is saying they're against helping kids who need dental care. But it's the notion, why are you using the Rhode Island Foundation? That's a nonprofit, it's not a state agency. Why don't you just go to the health department and say, here, you guys do it?
Yeah, because I want to make sure the money gets to where it needs to go, which is the neighborhoods that were affected by what Barletta did. 25% of kids in those neighborhoods have serious dental problems. I'm not talking about cavities, abscesses and infections. So I was really quite moved by a story that the Providence Journal did about an 8-year-old girl who had to have all of her bottom teeth extracted about a year ago. What did the government do in response? That was a story that was in the Providence Journal nearly a year ago. Our government did nothing. Rido did nothing. The governor did nothing. And so I want to do something about it. And by giving it to the Rhode Island Foundation, where I have a role in where it goes, and the court order says where it must go. Look, the Rhode Island Foundation for 100 years has moved money out to people who really need it. We are going to help these young children. They'll learn better in our school system, and a lot of good will be done.
I didn't expect to tell me that you don't trust the Department of Health. You just said, why not give it to them? Why not give it to the Department of Education? Why not give it to the Providence School District? There's a lot of places you could give it, other than a nonprofit that's not state. That's not state related.
I've worked for 7 years nearly. I've worked with state agencies. You know, we started our lead paint remediation program because Rido was not able to do it alone. We were there for the Prospect hospitals when Rido, candidly, you've pushed me there, Gene, I'm going to say it, wasn't there. When it came to the merger, we issued a decision. We've been at the forefront of healthcare, frankly, in Rhode Island. It's one of the reasons we propose a new, rebuilt state agency. Won't cost more, so let's not go there. But I wanted to make sure this money went to children like that 8-year-old girl who had to have every one of her bottom teeth pulled, and I know this will work. The state moved a ton of money, of APRA money, through the Rhode Island Foundation, as the speaker said. And so it's been used before, and it will be used well here. And We're going to be very public about how the money is used.
That's the part I'd
And
like to get to.
Absolutely.
You're going to provide oversight.
Absolutely.
You're going to guarantee that.
Guarantee. And the public will know where it's going.
Okay.
As I said on the radio, why would I hide?
I don't think oversight's a
spending the
question of
money.
hiding. Oversight is there. We have oversight committees. Oversight is there for a reason, just to make sure that the money is going where it has to go. Not a question of not trusting you or anybody else.
No, I get it. But my point is, people are going to know where it goes because it's doing real good. And look, I'm all for oversight. You know, I think we could do more oversight. We don't, when we do oversight hearings, we don't put people under oath. So there's a lot of ways we can improve that. But I'm confident this money's going to do a lot of good for a lot of kids who really, really need it.
Republican Minority Leader in the Senate, Jessica Dela Cruz, is on the radio. She said she'd like a couple of these homeowners who were directly impacted by the contamination to get some of that money. Here's what she said. Go ahead and play Senator Dela Cruz cut 1, please.
Those two families should also be made whole and should probably see some of those funds. The thing that I kind of take issue with is that this is an infrastructure project that taxpayers paid for. This wasn't, a settlement, say, like for opioids. This is an infrastructure project that was paid for by taxpayer dollars. So who deserves to be made whole in this situation? Obviously, those two people deserve to be made whole. I think the taxpayer deserves to be made whole.
All right, go ahead. She says a couple of those families that were directly impacted. Now I know you're going to argue it's not taxpayer money. It is public money.
No, it's not. That's not what I'm going to argue.
Is it public money?
Well, what the senator doesn't understand, frankly, is that the opioid money was about state money. The opioid money was about the losses that the state incurred for having to treat people who had either had overdosed or for prevention and treatment. So our claims as attorneys general are always for state losses. Okay, so there were no state losses from 610. Okay, there were no state losses there. And when we get to the families, we reached out to the families. The families have hired private counsel. They told us that they would do their own thing, and we have the documents to back that up. So the notion that we weren't trying to help the families, we weren't reaching out to families is just wrong.
Okay.
We reached out to their counsel. They wanted to pursue their own claims, as they have them. So I don't view this money any differently than any of the other claims that we bring on behalf of the state. My predecessor used money in much the same way. His predecessor used money in much the same way. We'll let the public know where it's going, and there'll be plenty of feedback when it does. We're going to put out an RFP. The public will have a chance to weigh in on that RFP.
Let's take one more break, and we'll get to a lot more things with the Attorney General. He continues as our guest. Let's continue with the Attorney General, who's willing to go after the home team in the form of CVS. You announced yesterday, we're taping on a Thursday, by the way, you're going to go after pharmacy benefit managers, PBM. Yeah. We have them here. That's the middleman. Your company says deal with them, and they'll get the drugs from the drugstore. In this case, CVS is the drugstore and the middleman. You see abuses here?
Well, look, PBMs, pharmacy benefit managers, there are only 3 significant ones. They control 80% of the market, and they've used that market to drive up drug prices. They hold themselves out as driving prices down and making drugs available to you. They list what drugs you can get if you're on that particular insurance. You can get some drugs and not others.
Yes.
We allege that what they're doing is deciding which drugs go on their what are called formularies, their lists of drugs you can get, based on how much the manufacturers kick back to them in the form of a so-called rebate. What that does, so manufacturers kick back. One thing that does is it limits the ones that don't kick back. You can't get those drugs. And this is always changing. That's why sometimes you'll get this, and you've got to change drugs because the kickbacks are changing. So these kickbacks not only impact what drugs you can get, but they drive the price up, because what the manufacturers do is raise their prices to pay for the rebates they're giving to the PEMs, which they pocket. And so rather than lowering prices, in fact, they're the cause for skyrocketing prices, and they limit what consumers can get and cause consumers to have to keep changing medications. That's why we brought the lawsuit.
The doctor may prescribe a particular medicine, and that one's expensive, and CVS will say you could have that form, but you have to take the
Well,
generic.
or you have to take another
Right.
brand, but not because it's cheaper, because they're getting a rebate from the manufacturer of that drug. And that's the problem. They're not doing it because it's less expensive. They're doing it because they make more. And that's not what they're holding themselves out to us and consumers as to how they're really doing it. That's why we brought the lawsuit.
In Arkansas, Governor Huckabee has banned PBMs that control pharmacies. In other words, that's CVS.
Yeah.
In return, CVS has decided to pack up, not doing business in Arkansas anymore. Why don't you take that step further?
Well,
ban a PBM that also has a drugstore unit, like CVS.
Well, look, that's not something I can do with my authority, but I'm using our litigation levers to bring fairness to Rhode Islanders. And look, you mentioned the Hope team. Look,
The home team.
Yeah. I get my flu shot at CVS. I get great service there. They're great. The brick and mortar pharmacies are great. Great people working there. But the home team doesn't get a discount if they're engaging in unlawful behavior. That has never been my reputation. I mean, the hometown speaker didn't get a discount when I was U.S. attorney. You got arrested. So look, if we have to take action against the hometown team, we're going to do it.
All right. Listen, has all of this talk about CVS and alleged abuses, has this cooled your relationship with Helena Folks? Wasn't that long ago you were talking about maybe running as a ticket. You'll run lieutenant governor, she'll run for governor.
Yeah, well,
you got the same relationship? Because she's Miss CVS.
Well, listen, we have a good relationship. I think highly of her as a person and as a thinker. She has to answer for CVS. I can't do that for her. But I have a good relationship with her. That hasn't changed.
Yeah, even with these renewed interest in opioid abuse and CVS's role.
Well, I haven't talked to her since we announced the suit yesterday, but I don't think our relationship is going to change. I mean, look, we do what we have to do, and I think Helena will understand why we're doing it, and then if to the extent it raises issues for her or questions, then she'll have to answer them.
Are you still talking about a possible ticket? Not a formal one, but
I'm not.
She'd run for governor, you'd run for lieutenant governor?
No, I'm not
interested.
interested. I am not interested in being lieutenant governor. Look, I feel like I only want to be in public service if I feel I can make a difference.
Yeah.
I feel I've done that as U.S. attorney. I feel like we've been able to do that as AG. I love the work that we're doing right now. If I feel I can contribute in some way, I'll explore it. But if not, I'll go on to other things.
You're interested in being governor?
I'm semi-interested.
Okay, let's talk about it. Because a lot of
Sure.
people think between yesterday and a couple of days ago in your news conferences that you might be straying beyond the role of an attorney general, prosecutor, regulator, and you're proposing legislation, you're proposing reforms. Is this to set up your run for governor?
No, I mean...
Let's ask it. Boom.
Yeah, sure, no. I mean, one of the reasons I wanted my team there with me yesterday so that people could hear from the great healthcare team that we've assembled.
Yeah.
And I thank the Speaker and the late Senate President for allowing us to do that by giving us the positions that, frankly, the governor would not give us. So I wanted them to speak, and if you heard the press conference or part of it or read the coverage, they did speak, because everything we're proposing, we as a team have agreed this is what we need to do now. Like partnering with the Brown School of Public Health is going to take us in some new directions we think can really help. So look, if I do run for governor, I'll be able to point to accomplishments.
Okay.
No doubt. But I think I should be able to. If you are in office and you can't point to things you've done successfully that the public can appreciate, you don't deserve to be in office and you don't deserve the chance to run for it.
So you are interested, and that door is open, and I may have you at some point saying you're running for governor.
Yeah,
is that a fair?
Yeah, you could.
Okay. All right, we just have a minute to go, so let's get... I do want to talk about the Washington Bridge, but I only have a minute, and we just ran out of time. You're overseeing the lawsuit, and again, with about 30 seconds, leading it. Have you found any wrongdoing on the part of the DOT or the state? Is there anything that you've had to call them up and say, you're doing this wrong, make a correction, or no? And again, I wish I had more time, but go ahead.
Yeah, look, we don't get involved in engineering. We are bringing a case based on past conduct. When that case gets to trial, the jury will have to decide if there is any comparative negligence, how much anybody was at fault. That remains to be seen.
Attorney General, thanks for coming in. I want you to come on my radio show because we'll get to the rest of the list of topics. Thanks. Attorney General Peter Neronha, thanks for joining us. That's 10 News Conference for this week. I'll see you next week and on the news at 6.